Any other major challenges that you guys seem to face when trying to titrate your patients?
I think there's two main ones that first is time. I mean, parents are busier than ever, and more often you have if you're lucky, you still have, you have two parents that are working. They're busier than ever. Kids are busier than ever, and there are a lot of other obstacles, like there are things in their lives that could be like psychosocial stressors, and practitioners are busy. And sometimes, when you're looking at your schedule and you don't have a lot of time left, and then they're comparing it to their life, and it's sort of like, it's not matching up. And that's sort of sometimes the biggest challenge is because we got to get together soon. Like none of us want to wait a month before we see them. I want to see the kid in the next 1 or 2 weeks. So that's a challenge. And the next challenge is that there's a supply chain shortage. It's harder than ever to prescribe stimulants. You electronically send it to a pharmacy, and then the patient goes to pick it up, and the pharmacy says we're out, and then they have to call us, and then we call other pharmacies, see if you actually have it. Then we have to resend the prescription, and that could take time. And in rare cases, you have to actually change from one medication to another, and that's another conversation because maybe it's the same or really similar, but you still want to have a conversation how they're a little bit different. And to me, that's the biggest barrier to getting kids effectively and timely treated is the time, because we all have really busy, chaotic lives. And then when you're doing your job and it's not anyone's fault other than there's just not enough of that medication or that pharmacy doesn't have it. And I don't know about you, I spend every day of my life, a portion of my life is redoing a prescription because it wasn't available, and that's a lot of burden on the patients, and they sometimes delay in care, and then for us because we're redoing our work, and I didn't do it wrong the first time. It's just unfortunately there wasn't there in that specific pharmacy.
And you add to that insurance coverage, so sometimes it's not clear what the patient's insurance will cover. And that's a real barrier to parents being able to in addition to the supply chain issue, is that we might prescribe a medicine that looks like it should be covered, and it might require prior authorization, or that may not be covered at all by their insurance. So that's another problem. I would add to the folks that are busy that David has so correctly pointed out. One of the best measures of medication titration effectiveness is a teacher rating scale, that the teacher rates specific ADHD behaviors during the school day. And although we advocate for 7 days a week medicine, because ADHD is a medical problem at the end of the day, not a school problem, and the home issues with redirection and correction lead to its own set of problems. But one of the best indicators of good medication management is, what is this teacher seeing in the classroom? And so often, but teachers are very busy too. And so many of them go the extra mile and update us, but it can be a challenge to get that information to the clinician.
Absolutely. And I mean, you're trying to base your best judgment on whether they're optimized or not. Are they progressing the way they should be based on this feedback you're getting from teachers, from parents? So how would objective measurements help aid in this?
I'll give you one. I was thinking of another challenge, and that is, let's say we're seeing a patient. Now, we're in the middle of the school year, right? But let's say we're seeing a patient at the end of May, early June, and he's just failed third grade. Or as one of my patients said last week, I redshirted third grade. Now I'm going to try to titrate medication, right? But I don't have any information, no input from the school or anything. And so maybe he's in day camp, and the parents are both working, so it can be hard to assess focus. And so that's when objective testing becomes, that's an example of objective testing being just absolutely essential. The other is measuring school performance by itself, even with the teacher rating scale, is not going to be without its problems, because there can be other reasons for inattention. The kid could be being bullied, or may have dyslexia or a learning disorder, or may have other issues going on besides ADHD that are affecting classroom behavior or focus. So objective testing can help clarify, okay, so he's not paying attention in the classroom, but that could be because of a learning disability or something that's tagging along with the ADHD.
And I would say, back to the sort of helping decrease barrier, because if you do need a prior authorization and you have something like a QB test, you have an objective score that they can't argue with. So you're like, look at this kid is in the 99th percentile for inattention, 98th percentile for hyperactivity, 98th for, like their symptoms are high. We have this test, and it helps. And back to the insurance, the other difficult thing about insurance is people change all the time.
Yes.
Because it's employer based. I think that's one of the worst things that happen, and people don't understand that just because you're on it, you have insurance X, and then you're on your father's insurance, and he gets a promotion, a new job, but now they have a different company, then they switch, and they forget to tell you that they switch, and then all of a sudden you put the prescription in and it's not going through, and they're like down, they're down to their last pill, because why isn't it going through? Because your new insurance is requiring a prior authorization for that medication, and it didn't matter that you were already on it, because this insurance this is a different one, and that's a huge sometimes problem where, and that's where also I like the objective testing, because it speeds up that, look, I've already done it, I'm going to just give it back. And so and that happens a lot, and I try to tell all my people, please keep us updated, because when and if you change insurance, there could be and we don't want to wait till you're on your last pill. Let's be proactive about it, but people are busy, and sometimes they forget, you forget, and job changes quickly, and then sometimes they're stuck with having to pay out of pocket for a month, and that could be pretty tough for them too.
Yeah.
With regard to QB test, one of the things that it's really helpful in making an objective diagnosis, but to get the objective feedback on the back end of symptom control. And one of the things that I find is most helpful when you have those two tests together, and the parents can see the result of that very busy movement parameter going down to size, and they can see that they're not missing as many of their targets, and they can see that the time to response is improved. It really helps them, I think, understand how important the medicine is, and that this is actually a neurological, that network that we talk about for focus, that keeps the smart kid brain online so that it can get things done, is connected, and we can demonstrate that with objective testing.
And do you find that when you're able to show them that visual quantitative representation of their child's progress, or their own progress depending on the patient, right?
Exactly. I think it really answers a lot of questions for them, because the symptoms of ADHD are not neurological, they're behavioral. And so having those cardinal parameters that are measured by QB test and seeing the improvement or not